Welcome to the class 10 of Medicinal Chemistry 1, Unit 2, Drugs Acting on Autonomic Nervous System, Part 5. In the previous class, we discussed about sympathomimetic, that is adrenergic agonist drugs, which is directly acting or indirectly acting on the adrenoreceptors. Now we will discuss about sympatholytic, that is the noradrenaline or adrenaline binds to the adrenoreceptors. What action will be produced by the agonist drug? So it reverse of action, that is antagonizes the effect of norepinephrine and epinephrine, which is called as adrenergic antagonist, sympatholytic or adrenergic blockers or adrenergic blocking agents. Sometimes these are also called as anti-adrenergic drugs. Now we will see the actions of adrenergic blockers. As I told, that they will block or reverse the actions of alpha and beta receptors. So blocking of alpha 1 adrenergic receptors, it's inhibit vasoconstriction. So it means agonist will shows the effect as a vasoconstriction, but the blockers will brings down to vasodilation. So while the adrenaline or noradrenaline bind to the alpha 1 receptors, it shows vasoconstriction, but the particular blockers, if it is block, the action means it reverse and it is vasoconstriction. So this produce fall in blood pressure, that is alpha 1 blocking action. Similarly, alpha 2 blocking with selective antagonist will increase sympathetic outflow and potentiate the release of norepinephrine from the nerve ending. If the alpha 2 agonists bind to the alpha 2 receptors, the actions will be it increases the release of sympathetic outflow, means norepinephrine is going to be released in more concentration, which leads to the activation of alpha 1 and beta 1 receptor in the heart, and consequently it raises the blood pressure. Coming to the classification of sympatholytic, class 1 is alpha receptor blocking agent. In that, first category is beta haloalkyl amine. The example is phenoxybenzamine. Phenoxybenzamine is N-benzyl, N2-chloroethyl, 1-phenoxypropane, 2-amine. It is used to treat peripheral vascular diseases such as Raynaud's syndromes. Raynaud's syndromes means in the cold condition, the arteries which supplies blood to the skin will be constricted and there will be a limited supply of blood to that particular area. That is called Raynaud's syndromes. Also used in the treatment of shock and in the treatment of pulmonary edema. The major use of phenoxybenzamine is in the treatment of pheochromocytoma, that is tumor in the adrenal medulla. The second category is imidazoline derivatives, that is tolazoline. Tolazoline is a 2-benzyl 2-imidazoline, and it is used in the treatment of persistent pulmonary hypertension of the newborns, and the effect, it possesses similar affinity for alpha 1 and alpha 2 adrenoreceptors. Actually it is a vasodilator. The second category in imidazoline derivative is phentolamine. That phentolamine is 3,4,5 dihydroimidazoline 2-eel methyl 4-methylphenyl aminophenol. It is an alpha adrenergic blocker used in urgent heart failure. It has two additional activity such as muscarinic activity and also a histaminergic activity. The next category is quinazolines. The example is prazosin. Prazosin is 1,4-amino 6,7-dimethoxy 2-quinazolinyle 4,2-furanil carbonyl piperazine. It is used in the treatment of hypertension of any degree, and it has been used in decreasing cardiac overload. The next category is ergot alkaloids, that is natural and dehydrogenated ergot alkaloid. The example is dihydroergotamine and methsergide. Both are ergot alkaloids, and these ergot alkaloids are derivatives of ergotamine used in the treatment of migraine. This is the synthesis of tolazolin. When 2-phenyl acetonitrile is treated with ethyl alcohol in presence of hydrochloric acid, a amino derivative is formed. This, upon treating with ethane 1,2-diamine, gives tolazolin. Thank you so much.